We knew that something might be going on just because he failed the newborn screening in the hospital, but they thought it was probably fluid in the ears, and so we just kind of assumed the same thing, and then they kept doing testing and eventually discovered that he had the hearing loss that that they thought he might have to begin with. So.
Yeah, so Owen was born with hearing loss, and he has what we would call bilateral profound sensory neural hearing loss, which means neither of his hearing nerves are working properly, or the nerve cells.
For most people, the cause of hearing loss is loss of either the number or the function of those hair cells. Those hair cells normally attach to the auditory nerve or the cochlear nerve that goes back to the brain and brings the signal to the brain. But when those hair cells aren't working, the signal is not transmitted up through the cochlear nerve back to the brain. What a cochlear implant does is it bypasses those malfunctioning or small number of hair cells and stimulates the ganglion and directly the nerve itself.
How well they do with hearing and speech afterwards really depends on our team of audiologists, and they will program it, make sure that things are working correctly.
After he gets implanted, about a month after the surgery, he'll come back to us and we'll activate one side. He's doing bilateral simultaneous, so he's getting both ears done at the same time. It's really difficult for us to do both ears, activate both ears at the same time, because we can't figure out necessarily how they're hearing right in the beginning. A child at 10 months can't tell us that the sound sounds good.
So he's definitely hearing these sounds, but I think just like the way his personality is, he's just kind of go with the flow.
They have a great team that really works well together, and they all are communicating together, behind the scenes. They've been really good at allowing us to ask any questions that we have and come in for extra appointments if we're just kind of, wondering what next steps are or we don't understand something. And they've been really good about helping.
Yeah, we can send Meredith emails and texts and get answers for random questions we come up with. So.
With appropriate follow-up and do speech therapy and all the other recommendations, when families follow that, children perform incredibly well. He's being implanted at such a young age that he'll probably catch up to his normal hearing peers pretty quickly.
One of the reasons that we try to implant our kids that we know will benefit from cochlear implants before the age of 1 is so that they can just catch up faster. Kids are pretty malleable and their brains are pretty plastic, so it's amazing what they can do. So as we follow these kids, some of our older kids, their speech is great.